What happens when arteries begin to harden? Hardening of the arteries, also known as atherosclerosis, is a gradual process that occurs when the walls of the arteries become thick and stiff. Healthy arteries are flexible and elastic, allowing blood to flow freely to all parts of the body. However, over time, factors such as poor diet, smoking, sedentary lifestyle, and even stress can cause the accumulation of fat, cholesterol, and other debris on the inner walls of the arteries. These buildups form what we call atheromatous plaques. Over time, these plaques can partially obstruct or even completely block blood flow, making the arteries narrower and stiffer. This hardening of the arteries makes it difficult for blood to circulate, meaning that oxygen and nutrients do not adequately reach vital organs, such as the heart and brain. The result is that your body has to work harder to send blood where it is needed. This puts extra pressure on the cardiovascular system, increasing the risk of heart disease and other serious complications. When an artery cannot expand properly, the heart needs to pump harder to force blood through, which can lead to increased blood pressure. In addition, other factors can accelerate the process of atherosclerosis, such as a diet high in saturated and trans fats, lack of physical exercise, smoking, and even diabetes. When these factors are present, the hardening of the arteries can happen more quickly and more severely, putting your health at risk. Fortunately, the hardening of the arteries can be slowed down or even prevented with healthy lifestyle habits, such as a balanced diet, regular physical exercise, and the elimination of harmful habits like smoking. The sooner you act, the lower the chances of serious problems in the future. The first sign that your arteries may be hardening is chest pain, also known as angina. When the coronary arteries, responsible for carrying blood to the heart, begin to narrow due to plaque buildup, blood flow to the heart decreases. This results in chest pain, which can range from mild to severe. This pain occurs mainly when the heart needs more oxygen, such as during physical exercise or stressful times. When arteries harden, they cannot expand properly to meet this increased demand. The result? Chest pain. The pain can be described as a feeling of tightness or pressure in the chest. It may spread to the shoulders, arms, neck, or jaw. Angina is not a heart attack, but it is a warning sign that the heart is not receiving enough oxygen, which can increase the risk of a heart attack if left untreated. Typically, chest pain related to hardening of the arteries occurs when the heart is required to work harder, such as during intense physical activity. However, it can also occur even at rest, in more severe cases when the obstruction of the arteries is more significant. If you experience chest pain, especially if it recurs or worsens over time, it is crucial to seek medical attention immediately. Chest pain can be a sign that the heart is at risk, and the sooner it is identified, the easier it will be to treat the underlying cause. Your doctor may perform tests such as an electrocardiogram or a stress test to assess how your heart responds to physical stress. In many cases, treatment may include lifestyle changes, medication, or even medical procedures such as stent placement to unblock arteries. Therefore, if you are experiencing any type of chest pain or discomfort, don't ignore it. This is the first sign that your arteries may be hardening, and early action can be key to preventing serious complications in the future. Another clear sign that your arteries may be hardening is excessive fatigue and lack of energy. When arteries become stiff and narrow, blood flow to the heart and other vital organs decreases. This means that oxygen and nutrients are not being delivered efficiently to the body's cells. To compensate for this reduced blood flow, the heart begins to work harder. But over time, this overload can result in a constant feeling of tiredness and lack of energy. This is because the muscles and organs are not receiving the oxygen they need to function properly. If you notice that you are frequently feeling tired, even after a good night's sleep, or if your daily activities have become more difficult to perform, this may be a sign that hardening of the arteries is affecting your body. Chronic fatigue can be an indication that the heart is not pumping blood efficiently, impairing the distribution of oxygen and nutrients throughout the body. This lack of energy isn't just about physical exertion. It can also affect your mental and emotional health. Excessive tiredness can lead to irritability, difficulty concentrating, and even depression. If hardened arteries aren't supplying the necessary energy to the brain, it also suffers. It's important to remember that excessive fatigue can have various causes and isn't always related to hardened arteries. However, if you're also experiencing other signs, such as chest pain or increased blood pressure, this may indicate something more serious. Consulting a doctor is essential to perform tests that identify the cause of fatigue and, if necessary, treat hardened arteries. While you await a diagnosis, a good practice to improve blood flow and combat fatigue is to incorporate moderate physical activity into your routine, such as walking or cycling. These exercises help improve circulation, reduce stress, and increase energy levels. Furthermore, a balanced diet rich in fruits, vegetables, and whole grains can help improve the health of your arteries and increase your energy throughout the day. Early treatment to reduce the risk of hardening of the arteries can make all the difference in your quality of life. The third sign that your arteries may be hardening is increased blood pressure. When arteries become stiffer due to plaque buildup, they lose their ability to expand properly, making it more difficult for blood to circulate. As a result, the pressure inside the arteries increases, leading to hypertension. Normally, blood pressure is maintained within a healthy range because arteries are flexible and can adapt to blood flow. However, when arteries become narrower and stiffer, they cannot dilate as they should. This means the heart has to work harder to push blood through these stiff arteries, resulting in increased blood pressure. Hypertension, or high blood pressure, can be a silent problem, as it often presents no obvious symptoms. But when arteries harden, the risk of serious complications increases considerably. High blood pressure forces the heart to work harder, which can lead to weakening of the organ and an increased risk of heart attacks, strokes, and kidney failure. It is important to monitor blood pressure regularly, especially if you already have risk factors for hardening of the arteries, such as a diet high in saturated fats, lack of exercise, or a family history of heart disease. Periodic measurement can help detect hypertension early and allow you to take the necessary steps to control it. In many cases, treatment for hypertension may involve lifestyle changes, such as adopting a healthy diet, regular exercise, and, in some cases, the use of medication to control blood pressure. The goal is to reduce stress on the cardiovascular system and prevent serious complications. Regular physical exercise is fundamental to controlling blood pressure. Even simple activities, such as daily 30-minute walks, can help improve blood circulation, reduce blood pressure, and promote artery health. Furthermore, a balanced diet rich in fruits, vegetables, and low-sodium foods can have a significant impact on blood pressure control. If you're concerned about high blood pressure, consult a doctor for evaluation and guidance on how to manage this condition. The sooner hypertension is treated, the less likely it is to cause damage to the arteries and heart. Identifying early signs that your arteries are hardening can be challenging, as many of these symptoms don't become obvious until the problem is more advanced. However, being aware of symptoms such as chest pain, excessive fatigue, and high blood pressure can be crucial in detecting the problem before it becomes serious. The best way to identify these signs early is through regular medical checkups. Monitoring your blood pressure, having cholesterol tests, and undergoing cardiac stress tests can help detect hardening of the arteries before symptoms become evident. Even if you don't feel pain or discomfort, these tests can reveal underlying problems. If you have risk factors, such as a poor diet, a family history of heart disease, or a sedentary lifestyle, it is even more important to carry out these regular checkups are essential. Early detection allows you to take the necessary steps to treat the problem and avoid major complications, such as heart attacks or strokes. When signs of hardening of the arteries begin to appear, it is vital to seek medical help. The sooner you seek professional guidance, the more effective the treatment will be. Your doctor may recommend a combination of lifestyle changes, medications, and, in some cases, medical procedures such as angioplasty or the use of stents to restore blood flow in the arteries. Remember, acting early can save your life. Don't ignore signs such as chest pain, excessive fatigue, or increased blood pressure. The sooner you seek help, the greater the chances of treating the problem before it worsens. The good news is that, with the right interventions and lifestyle adjustments, it is possible to improve the health of your arteries and reduce the risks to your heart. What you do today can determine your health in the future. Pay attention to the signs and don't delay seeking medical care. Now that we've discussed the signs and how to identify hardening of the arteries, it's time to talk about how to prevent this problem before it happens. The good news is that you have the power to protect your arteries and your heart with healthy choices in your daily life. Let's explore some of the most effective ways to prevent hardening of the arteries. First, diet is fundamental. Eating a balanced, nutrient-rich diet can have a direct impact on the health of your arteries. Foods rich in healthy fats, such as avocado, olive oil, and fish like salmon, help lower bad cholesterol and raise good cholesterol. Foods rich in fiber, such as fruits, vegetables, and whole grains, are also essential, as they help keep cholesterol levels under control. Regular physical exercise is another important pillar. Practicing physical activities, such as walking, running, swimming, or even yoga, improves blood circulation, helps control cholesterol, and regulates blood pressure. Ideally, you should move for at least 150 minutes a week, or about 30 minutes a day, 5 times a week. Physical activity not only strengthens the heart, but also contributes to the flexibility of the arteries. Reducing stress is another crucial factor. Chronic stress can increase levels of cortisol and adrenaline, hormones that contribute to increased blood pressure and arterial stiffness. Practices such as meditation, deep breathing, and yoga are extremely effective in reducing stress and improving cardiovascular health. In addition, leisure and rest are also important for emotional and physical balance. Regular medical checkups are essential. If you have a family history of heart disease or other risk factors such as diabetes or hypertension, routine checkups to monitor your cholesterol, blood pressure, and glucose levels are fundamental. The sooner you detect changes, the easier it will be to control them and avoid complications. And, of course, quitting smoking. Smoking is one of the main enemies of cardiovascular health. It contributes to the formation of plaques in the arteries, increases blood pressure, and reduces the ability of arteries to expand and contract properly. If you smoke, quitting is one of the best decisions you can make for your health. Furthermore, if you already have hypertension, it's important to keep your blood pressure under control. This can be done with the help of medications prescribed by your doctor, along with lifestyle changes such as a low-sodium diet and regular exercise. In short, what you do every day can determine the health of your heart and arteries in the future. Adopting a healthy diet, exercising, reducing stress, quitting smoking, and having regular checkups are simple measures that make a big difference in preventing hardening of the arteries and increasing your quality of life. As we age, the risk of hardening of the arteries naturally increases. This process is part of aging, but it can be accelerated by unhealthy lifestyle habits. Over time, arteries lose their flexibility and ability to dilate and contract efficiently, which is necessary for good blood flow. With age, arteries begin to accumulate more deposits of fat, calcium, and other substances on their inner walls. This process, known as atherosclerosis, makes the arteries narrower and less flexible. This hardening is a normal part of aging, but it can become problematic, especially when combined with other risk factors such as an unhealthy diet, lack of exercise, or a family history of heart disease. After age 50, the likelihood of suffering from hypertension and arterial hardening increases considerably. This occurs because, with age, the cardiovascular system loses some of its elasticity, becoming less efficient at transporting blood. When arteries become more rigid, the pressure within them increases, putting more strain on the heart and increasing the risk of heart disease. While natural aging cannot be avoided, adopting healthy habits can slow this process and improve artery health. Maintaining a nutrient-rich diet, engaging in regular physical activity, and controlling blood pressure are actions that can lessen the impact of aging on the cardiovascular system. It's important to understand that, while age is an unavoidable risk factor, your lifestyle plays a crucial role in the health of your arteries. No matter your age, starting to take care of yourself now can help you live longer with quality of life and fewer heart-related complications. Although lifestyle factors such as diet and exercise play a crucial role in artery health, genetics also has a significant impact. If someone in your family has a history of heart disease or high cholesterol, this can increase your predisposition to hardening of the arteries. What many don't know is that genes can affect how your body handles substances like cholesterol, fat, and even blood pressure. If your parents or grandparents suffered from heart disease, you may have a genetic predisposition to conditions like atherosclerosis, meaning your arteries may harden more quickly than normal, even if you adopt a healthy lifestyle. That's why, if you have a family history of heart problems, it's even more important to monitor your cardiovascular health. Regular checkups, such as cholesterol and blood pressure tests, can help identify problems early and allow you to take preventative measures. Your genes can influence how your body reacts to certain factors, but that doesn't mean you can't control the risk. Even with a genetic predisposition, lifestyle changes, such as a healthy diet and exercise, can help minimize the impact of genetics. Therefore, while genetics is an important factor, it doesn't define your destiny. If you have a family history of heart disease, adopting healthy habits now can make all the difference in protecting your arteries and keeping your heart healthy for many years. Now that we've explored the signs that your arteries may be hardening and how this can affect your health, it's important to know that prevention is within your reach. The choices you make every day can determine the health of your heart and arteries in the future. Adopting a balanced diet, rich in fruits, vegetables, healthy fats, and whole grains, is one of the most effective ways to protect your arteries. Avoiding processed foods, high in saturated fats and sodium, helps reduce plaque buildup in the arteries and keeps the cardiovascular system healthy. Regular physical exercise, such as walking, running, or swimming, is also crucial for maintaining flexible arteries and proper blood circulation. Even small changes, like walking 30 minutes a day, can have a big impact on your heart health. Monitoring your blood pressure and having regular checkups are important steps to ensure your arteries remain healthy. Early detection of any changes in blood pressure or cholesterol can prevent serious complications, such as heart attacks or strokes. Remember also the importance of reducing stress. Practices such as meditation, yoga, and leisure time help control blood pressure and protect your heart. Small lifestyle changes can be powerful when it comes to preventing hardening of the arteries. Now that you know what can be done to protect your arteries and your heart, it's time to act. The future of your cardiovascular health starts today, and every little change counts. Take care of your body, take care of your heart, and live a long and healthy life.